Hello, my name is Jakayla Gibson, and today I will be speaking underneath the category of diversity and inclusion. And my topic will be COVID-19 and racial disparities. COVID-19 has consumed the lives of millions, along with halted the normal functioning of those who are still struggling with the aftermath of experiencing COVID-19. But even within this worldwide pandemic, we still are seeing systemic racism at work, as racism does not take a day off. The biggest problem that we have right now is vaccine allocations. Firstly, it's difficult for you to get your hands on a vaccine, even though millions are coming out every day. The problem is, what areas are they going to? These are going to be the richer locations, the locations that are less densely populated with lower income people and specifically people of color. But today I'm going to be speaking mostly from the Black community perspective. We as Black individuals are dying, third to Mexican Americans, but more than white Americans have ever experienced. And this is not, a fluke accident. This is because vaccines are located in the richer areas, as I had explained before. The long and short of it is that where there is more money, it is more densely populated with white individuals, so white individuals are going to get better care than their minority counterparts, especially when we're thinking about the Black community. We are disadvantaged when it comes to the vaccines, and that is why we are dying more than our white counterparts. It has become so bad that a Florida governor had said that there was a VIP vaccine line for people who were in a higher tax bracket to be able to get into these long lines that people are waiting for, my family included, almost to skip ahead of the line, the VIP list, and to be taken care of. This is a very huge problem. And I know what you're thinking. Well, I know many Black people who are in the 1%. Well, by saying that, we are completely eradicating the history of the 1% being predominantly held by white individuals. We see this with the burning of Black Wall Street in Tulsa, Oklahoma. This was the hub of Black economic success. And whenever we were able to be comparable to the 1%, in fact, even more than the 1%, but as we became more successful, there was rioting and there was murdering of all of the people who would have been the billionaires, the Bill Gates, the Black Bill Gates in the making, as Beyonce says. It's made it as to where there is no 1% that's equivalent to white people. There is no 1% where people of color are historically based in it. So whenever you're thinking about VIP, when you're thinking about richer locations, we must address that historically this is entrenched in white history, and it continues to be a problem today. Let me spin this in another direction, another perspective. A close relative of mine was perfectly healthy until he contracted COVID-19. And with COVID-19, obviously you have the inflammation of the lungs. And all medical professionals are aware of this. And so whenever my close relative was put into the hospital, they knew that there was a high possibility that he would have inflammation of his lungs. But instead of taking care of him, they looked around, and this is Oklahoma, they looked around and at their white elderly counterparts, and they said, well, he is not a priority. This is the fact that has carried all Black people, even today. We do not have the luxury to be taken care of with treatment and the proper care, even though we are still American citizens. We simply don't. And so whenever we think about the mask mandate problem, why are people so eager to not wear a mask? Well, really what we're showing is it's not about the fabric around your face. It's about expressing the freedom to do as I wish, because I know that no matter what I do, there will be no consequence, as if I am a white individual, I will be treated no matter what, and with the utmost care. We as Black people are treated, but as I spoke about my close relative, it is not in the same way as our white counterparts. So whenever we're thinking about this issue of willful defiance, it is more so talking about, it's giving you a snapshot of just how different it is for Black Americans versus white Americans when it comes to dealing with this COVID-19. But I do not digress in saying that we are not the only people of color that are going through a struggle. I also want to talk about my Mexican American individuals. An Arizona governor recently said, and I'm paraphrasing, of course, that Mexicans are good workers, but in terms of vaccines, Americans should be given the vaccines before they are. This is also insinuating that there are no Mexican Americans. And Mexican Americans are 3.2% higher in hospitalizations and have 20.7% of cases, which is way higher than their white counterparts. Not only that, but Asian Americans are facing hate crimes at 1,400% due to the rhetoric of Kung flu virus, the China flu of previous presidencies. And Native Americans are also being struck very hard because they are already not given the proper funding for health care as being on reservations. So you're seeing that there is so much racial division, even in the smallest fact of survival. We are people and we are Americans, and we deserve to be treated and cared for equally. But the sad fact of the matter is, we still live in a very literal black and white world, even though this is 2021 and we should already be in Technicolor. Thank you so much for watching. My name is Jakayla Gibson. Goodbye.